Hello, my name is Courtney Byers, and I am reviewing an article titled Peduncular Hallucinosis, a Syndrome of Impaired Reality Monitoring by Thomas Binke from the Journal of Neurology, year 2006. Peduncular hallucinosis consists of visual hallucinations caused by lesions in the brainstem and the thalamus. The visual hallucinations are normally colorful and animated, and they occur predominantly at night. The most common images are animals, people or children, deformed faces, and landscapes. Most of what is known comes from case studies. However, not much is known because there have been very few report cases. The purpose of this study was to discover a better understanding of the characteristics of peduncular hallucinosis. The author set out to solve inconsistencies of previous case studies and to learn more about the clinical and behavioral presentation. Additionally, the study helped to find a greater understanding of the role of the brainstem on cognition and behavior and to extend the information to visual hallucination. This case study consisted of 5 patients, which were observed in the clinic from 1994 to 1999, and whose ages ranged from 41 to 85. They were named MG, GL, MF, FH, and AH. When abnormal behavior of the subject was observed by a relative or someone in the hospital staff, the subject was immediately interviewed. The subject gave detailed descriptions of what was seen, and they were asked to state their attitudes and emotions at the time of the occurrence. Visual fields and acuity were tested using the confrontation method and a reading card. The patients were also assessed on basic orientation, speech, verbal memory, word fluency, and general mental functioning on a series of tests. The hallucinations of these patients were generally vivid, complex, and scenic. They rarely involved auditory or tactile stimulation, and they lasted several minutes, with some recurring over several weeks. The hallucinations were described as natural in nature, and they elicited strong emotional responses. 3 of the patients, GL, FH, and AH, had reduced mental functioning, and patients MG and MF had significant mental impairment. The verbal memory of the patients was impaired with poor short-term memory and long-term memory. All the patients showed disorientation and confusion on occasion. 4 of the patients confused strangers as their relatives and also had conversations with deceased relatives. 2 of the patients showed confusion of the location of the hospital room, claiming it was duplicated and placed in a different location. Patients MG, GL, and MF could not fully understand their neurological impairment. They also had spontaneous confabulations in which they told fictitious stories. Patients MG and GF, on repeated occasions, had their eyes closed but denied it. Patient MG had a lesion in the right perimedian thalamic region, which extended to the midbrain, and also had another lesion near the left posterior cerebral artery. Patient GL had multiple lesions in the pedunculi and tegmentum. Patient MF had a pontine hematoma that extended into the midbrain, and patient MH had an infarct in the right perimedian thalamus and the cerebral peduncle. Finally, patient AH had a lesion extending from the left perimedian pons to the midbrain. The visual hallucinations of peduncular hallucinosis are typically associated with the evening hours. However, the patients had visual hallucination that also occurred in daylight during normal wakefulness. A commonality seen between all of the hallucinations were images of people and places that the patients were familiar with. Most of the reactions caused the patients to respond either verbally or physically. Negative emotions, such as anger, panic, or anxiety, were experienced most of the time, with positive emotions occurring rarely. Patients emphasized the realness of the hallucinations, with all of them believing that the hallucinations were real events. only patient GL admitted in retrospect that the hallucinations were not real. All of the patients had a severe amnestic syndrome. As mentioned in the results, the patients showed poor memory based on the test administered. However, the patients gave a full description of their hallucinations at the follow-up, which was highly consistent with their original descriptions. They concluded that this result is consistent with the fact that emotional experiences are remembered well. This also indicates that the memory loss was not only episodic. A common behavior abnormality of the subjects was misidentification, associated with the poor awareness of one's body state and cognition. The production of confabulations indicates their inability to differentiate right information from wrong. All of these observations are similar to behaviors characteristic of midbrain and diencephalic lesions. The lesions in these 5 patients occurred in the thalamus, midbrain, and pons. Specifically, it seems that the cerebral peduncles and paramedian midbrain structures are common lesion sites in patients with peduncular hallucinosis. They concluded that lesions of the midbrain and/or pontine structures are the cause of the cognitive deficits. Overall, they concluded that peduncular hallucinosis consists of hallucination coupled with cognitive and behavioral abnormalities and impaired reality monitoring. One issue of this case study was whether the diagnosis of peduncular hallucinosis was accurate for each one of these patients. The author claimed that based on follow-up examinations, the patient's hallucinations were not a consequence of other neurological disorders. However, he then claimed that 2 of the patients might have had vascular or strategic infarct dementia. The symptoms and behavior of the patients in this case study contradicts that of other case studies. For example, the patients in this case study exhibited confusion. However, other case studies have found that patients with peduncular hallucinosis typically do not exhibit any type of confusion and are in a clear state of mind with clear sensorium. Also, the patients could not distinguish the hallucinations from reality in these case studies. However, other case studies define peduncular hallucinosis as the ability of the patients to distinguish visual hallucinations from reality. Lastly, the hallucinations in these case studies were not only visual. However, previous case studies of peduncular hallucinosis had patients with only visual hallucination and nothing auditory or tactile.